Hello. In our previous video, we looked at the basic anatomy of a normal ECG. In this video, we're going to look at different stages of cardiac cycle. Before watching this video, I would encourage you to watch my previous videos on cardiac ECG, heart anatomy and physiology, and other anatomy videos because those videos may help you to understand this video. Okay, so before going into each of those stages, let's identify the stages. The first stage of cardiac cycle is diastolic filling. Second stage is isovolumic contraction. The third stage is ejection. And the last stage of cardiac cycle is isovolumic relaxation. Now remember, isovolumic contraction comes before ejection while isovolumic relaxation comes after ejection. Now the first stage of cardiac cycle is diastolic filling. Now during diastolic filling, the pressure in the atria exceeds the pressure in the ventricles. So blood flows from right and left atrium into right and left ventricle respectively. Now during diastolic filling, the atrioventricular valves are open and the semilunar valves are closed. The second stage of cardiac cycle is isovolumic contraction. During isovolumic contraction stage, the pressure in the ventricles exceed the pressure in the atria. Since the pressure in the ventricles exceed the pressure in the atria, they cause the atrioventricular valves to close. Now, the semilunar valves were closed even during diastolic filling, and they're even closed during isovolumic contraction. So there is no exchange of blood volume happening during isovolumic contraction. Despite no blood volume being exchanged during isovolumic contraction, the pressure in the ventricle is increasing. So the main thing you need to remember about isovolumic contraction is all of the valves are closed, no blood volume is being exchanged. So blood volume in the ventricle is not increasing, but the pressure is still increasing during isovolumic contraction. The third stage of cardiac cycle is ejection. During ejection, the pressure in the ventricles exceed the pressure in the aorta and the pulmonary trunk. Since the pressure in the ventricles exceed the pressure in the aorta and pulmonary trunk, they cause the aortic and pulmonary valve to open, and this causes the blood to be rushed into the aorta and pulmonary trunk. This rushing of blood into aorta and the pulmonary trunk causes a spike in blood pressure. Ejection is similar to ventricular systole, where there is blood being ejected into the aorta and pulmonary trunk. Now, during ejection, the semilunar valves are open, but the atrioventricular valves, both of those valves are closed. Now, the last stage of cardiac cycle is isovolumic relaxation. Isovolumic relaxation is the last stage of cardiac cycle, and during isovolumic relaxation, the pressure in the aorta and the pulmonary trunk exceed the pressure in the ventricles. And this exceed in pressure causes the aortic and pulmonary valve to shut close. During isovolumic relaxation, all the four valves are closed. There's no blood volume being exchanged during isovolumic relaxation. During isovolumic relaxation, one thing that does happen is atrial filling happens. So blood is being rushed back to the atria, and atrial filling or atrial diastole is happening, but the pressure in the atria is not higher than the pressure in the ventricles. So diastolic filling has not occurred, but atrial filling is occurring. So those are the four stages of cardiac cycle. Now, to better understand all of those four stages, this diagram is really helpful. I took this diagram from this link below, so the credit goes to the link. I didn't make the diagram. I got it from a link. Now, in this diagram, you can see all of these four stages clearly. The A in this diagram represents diastolic filling. During diastolic filling, there's a little increase in ventricular volume because volume or blood volume is being rushed into the ventricles. And because of that, there's also a little increase in blood pressure. Again, the atrioventricular valves are open, but the pulmonary valves, the semilunar valves, pulmonary valve and aortic valve, the semilunar valves are closed. This stage is isovolumic contraction because the atrioventricular valve closes and so is the aortic valve or the semilunar valve closed until it opens here, which is another stage. So this is isovolumic contraction. You can see that during this stage, the volume in the ventricle is not changing, but the pressure, as we said, is increasing. Now, when the aortic valve opens, that's ejection stage. And as we have said earlier, that during ejection stage, there's a sudden spike in blood pressure, which we see here. And also, there's a sudden decrease in ventricular blood volume. It makes sense because blood is being ejected into the aorta and the pulmonary trunk. This change in blood volume is called stroke volume, which is the amount of blood pumped in each beat. Now, when the aortic valve closes, that's when isovolumic relaxation starts, and it stays until the atrioventricular valves open again, which is when they open, we see diastolic filling, which is another cycle. But during this stage, when both valves are closed, that's isovolumic relaxation, that's after ejection. Again, the volume in the ventricle during isovolumic relaxation is not changing. Pressure over here is decreasing, but the volume is not changing. And then during this stage, atrial filling happens. So that's all for cardiac cycle. And one more thing, you can also see the ECG during each of those 4 stages of cardiac cycle. Thank you for watching the video.